Day 3 in the life of a neurologist. People have been asking me, what is a typical day for a neurologist like? And today was another one of those interesting days. I saw a guy who was 54 who had a strap of numbness across his chest. Didn't have any back pain, no problem in his arms or legs or face. And 54-year-old white man, rare to see MS in that age group, but transverse myelitis, commonly seen with MS, would be one of the top things in the differential. He'd already had an MRI of his thoracic spine. He showed a little disc bulge, but the spinal cord looked normal on STIR sequences. You know, if you look at your spinal cords, always make sure you're on a high field magnet that has STIR, STIR sequences, because that's the best way to see the spinal cord. So he's going to have an MS workup. We look at the MRI of the cervical spine and brain, because sometimes with MS it's hard, and many times it's hard to make the diagnosis, and you have to look at lesions in several different places. So MRI of the brain, cervical, and thoracic cord. The other thing is, does he have postherpetic neuralgia? I think it's more likely he has like an intercostal neuralgia from something like postherpetic neuralgia or an autoimmune problem. So we're going to do this MS workup, then probably going to give him some epidural steroids. They work great for this, epidural steroid injections. He also was already taking Neurontin, gabapentin, and it was helping. And he had slowly increased the dose himself, was much better on 3 a day, so I bumped him up to 4 a day. And right after I saw him, I did a nerve conduction EMG on a lady. Totally normal in her left arm and leg, but she had numbness of her face, arm, and leg. She was 27 years old. So this young girl, she has multiple sclerosis or a small right thalamic CVA until proven otherwise. The thalamic nucleus is where all the sensory fibers go in. Only place you can get pure numbness on one side is from the thalamic nucleus. So an MRI of the brain will show that. So that's the workup she's going to get. I saw another lady, and she had just tremulousness in her hands. And I call this the Katharine Hepburn syndrome. Katharine Hepburn was a great actress. I loved all her movies. And she had essential tremor, benign essential tremor, and she had probably one of the worst ones you'll see, because she had it in her voice and she had it in her head.
Because then I would be fixing it so that you knew my secret.
I remember seeing her on public television years ago. She said she made $2 million a year yelling at Spencer Tracy on Broadway. She used her tremor, and she was very confident about it. So this lady had a very small flexion extension tremor. There's a Parkinson tremor is more of a resting tremor, pronation, supination. So I put her on low-dose Inderol. Really works well, particularly in women, and we'll just see how she does. We'll check her thyroid screen to make sure she doesn't have hyperthyroidism. And I saw a lady right after that they asked me to do nerve conductions of her legs, and they were normal. But what she had was restless leg syndrome. And restless leg syndrome in women is iron deficiency until proven otherwise. And I always get a serum iron, TIBC, and ferritin. Now this is the key. Ferritin is almost never ordered, but your level needs to be over 50. Ferritin level over 50. So we ordered all of that on her, and I put her on low-dose Mirapex. We use actually Parkinson medications for it, like dopamine agonists, Requip, or Mirapex. I just like Mirapex better. And if someone's really reliable, a little bit older, Klonopin by far works the best. It's just so abused by younger people that we don't use it, except in really older people. I saw another guy today for a nerve conduction EMG study, and his legs, his heels were numb, his feet were numb down to his big toes. When I originally did the nerve conduction, it was completely normal, but we didn't check the medial and plantar nerves, medial and lateral plantar nerves, and we went back and checked those, no potentials. He had tarsal tunnel syndrome. So everybody has carpal tunnel. These are carpal bones. There's a tunnel in your wrist. There's the same tunnel on the side of your ankle. Your foot bones are tarsal bones. And he had bilateral tarsal tunnel syndrome. As bad as his was, very little, I think, is going to help this but surgery. Then the last guy I saw, he had neck pain right into his left deltoid muscle. He said specifically that's what feels weak. It raised to the deltoid, sometimes radiates down further. I did an EMG study, and that was the only thing breaking down was the deltoid. That's purely C5. And I looked at his MRI. He had severe neurofemoral stenosis, C4-5 on the left. And he's going to need surgery. Now, the nerve is named from the vertebral body below, so C4-5 disc, it's a C5 nerve root crosses over it. So you just go to the MRI, C4-5, look at C5, and it's purely deltoid. That was sort of easy. The biceps is supplied by C5 and C6, so you have to look at C4-5 and C5-6. So C6 would be from C5-6 because it's labeled below. So another interesting day in the life of Dr. Miller, the brain doctor. Now this is Dr. Caudill Miller, the brain doctor. Like, comment, subscribe. I answer every comment within a few days to a week, and more later.